Good afternoon, everyone, and thank you for joining this Salt Lake Chamber webinar on the state's new COVID-19 Transmission Index. I'm Derek Miller. I'm President and CEO of the Salt Lake Chamber and Downtown Alliance. As I referenced, on Tuesday, the state of Utah released new coronavirus health guidance levels known as the COVID-19 Transmission Index. That replaces the Utah Leads Together color-coded guidelines. This new index is a balanced approach intended to protect communities, and it also represents the collaborative work of state, local public health officials, of course, the governor's office, legislative leaders, the hospitality industry, and I'm pleased to say also business leaders from across the state. Today for this webinar, we're pleased to be joined with Dean Taylor Randall of the David Eccles School of Business at the University of Utah, and Rich Saunders, who is the Interim Executive Director at the Utah Department of Health. I'm sure this will be an insightful, informative, and helpful session. We hope that it will help to provide you information on the new COVID-19 Transmission Index, as well as give you an opportunity to ask questions later on during this webinar. We'll be focusing on what data is used to help inform the index, what this means for your business, and more. So I'm pleased to turn the time over to my friend Taylor Randall from the University of Utah. Thank you for being with us.
Derek, thank you, and welcome to everyone participating today. I think we intend to make this an interactive session, and so I'm going to be asking some questions of Rich Saunders to provide some context for why the change, what it means to each of you and your business, and then the chat function is available, and we will also be willing to take many of the questions that you have from the audience. As Derek mentioned, this has been a collaborative effort, and I want to thank Derek, who participated in many meetings over the last 3 to 4 days, representing the interests of business to try to make sure that business would have clarity in how they could continue operations during this crisis. We want you to know, and Rich will provide more of this context, that we felt a change was necessary for a number of reasons. One, we have learned a lot about how to manage COVID, and the prior guidance was becoming rather cumbersome. Much of the directive that would come under the prior system required permissions given by health authorities and state officials. And the reality is you all know how to manage this crisis in sophisticated ways now. And so one way we think about this new guidance is much like an air pollution guide. Some of you that live in rural Utah don't have to live under those circumstances, so perhaps not the best analogy. But really what you're going to see are areas of the state at the county level changing in their level of transmission from high, moderate to low. And that will be just based on data that is occurring at a health level in the county. And that will be announced every Wednesday. And that announcement will just be automatic based on the data. And you may switch up and down based on that announcement. Now, one thing that is important to note is if your county moves from a lower level to a higher level, you will be required to stay there for 2 weeks until you move back down. But that is kind of the basic functionality. A lot of what this index relies on is information. And we're fond of saying, water needs to get to the end of the row. This information needs to get down to the individual citizen, to the customer of your business, to every employee that you have. And the information that's really critical is, here's where we are in the index in our area, and here is the guidance and how we're supposed to behave. So with that brief introduction, Rich, I'm going to ask you to just kind of explain the guidance and how it moves back and forth. But before you do that, would you like to just kind of give your perspective on why you thought this change was necessary?
Thank you, Taylor and Derek, and it's good to be with you all. Taylor, just for my information, give me a kind of a high-level view of who's on with us today.
We have all of our county and local officials that are with economic development, as well as business leaders and Chamber of Commerce individuals around the country. And it looks like we've got about 140 individuals. Derek, do I have the audience right today?
Yes, and I want to also maybe just take that moment to say thanks to all our partners, different industry associations and local chambers of commerce who sent this through their networks as well. So this is really statewide representation.
Yeah, thank you. It's good to be with you all. I hope that the time that we spend together will be meaningful to you. So maybe if you would help take responsibility to help it to be meaningful by virtue of steering the conversations in ways that are meaningful to you, that would be helpful. Taylor, in response to your question, you know, as we've worked together through this and with many others, one of the facts that we must face is that we're in a very important crossroad right now. We have an average case rate, daily case rate, that is extremely high, and it's plateaued a little bit around 1,100 cases per day. But the concern is the exponential spread that could occur, especially if we don't bring this under control. Now, why is it so critical to bring it under control? There's a lot of differing opinions, all the way from it's all a hoax, all the way down to the other end of the spectrum, which is that we've had loved ones who have literally passed away because of it and would be alive today if it were not for this virus. So the spectrum is wide on those opinions. But one thing is for sure is that we are in a real situation, and we have the cases are an indicator of hospitalization, and the hospitals are reaching, certain hospitals are reaching levels of capacity that are very uncomfortable, and load leveling is having to occur. And we're concerned mostly about the fact that we may not be able to get care to those that need it most because there's not availability in hospitals. And I could go into specifics on that at some other discussion. But
Rich, maybe I could just break in and let's make sure everyone understands the significance of that. In economic terms, we also often talk about externalities of our own individual actions. What is happening right now to hospitals? I mean, I may look at my individual hospital in a community and it looks like it's fine, but a hospital in another area is overbooked. So what happens to my hospital in that case?
You know, what's happening is we use, and by the way, in our model, we use a statewide ICU metric. And we use a statewide that applies to all counties because the ability to take care of patients is a statewide issue. And what's happening right now, on a call I was on Monday, the hospital executives and those that are trying to figure out how to manage through this talked about specifically that on that very day and over the weekend, they're having to transfer patients from one hospital to another hospital. So for example, an IHC or a University of Utah patient over to a Steward facility, because the ability to care for patients is maximized. And it doesn't always mean beds. It could mean that the personnel, the trained staff that is able to offer that type of help is stretched too thin. And if I could add one more comment to that, it is that these are the staff, heroic staff that have been working literally to the bone. Now we're going on 7 months of this. It's absolutely, utterly exhausting. And we heard a report a week ago that in some situations, upwards of 10 to 15 or 20% of the staff that they need to manage the situation are not able to come into because they're either sick or they're exhausted and they just need a break. So when you put that kind of a taxation on the resources of the hospitals, it gets pretty tricky to manage. I'm not a hospital expert, but this is just from my perspective dealing with the hospital experts.
Thanks, Rich. So tell us about each of these levels and how we determine whether a county is in each level.
Okay. It would be good if I could share screen. Am I able to do that?
I believe so. If not, I can try for you.
You could, I'm going to I'm going to text you a link.
Would you like me to pull up the PDF that you have?
Well, sure, that's okay to do that. I was going to take you on the coronavirus site so that people can see where it's available on site, but we can go the other way too. Yeah.
I can do the site if you would prefer.
Yeah, just go to coronavirus.utah.gov/Utah-health-guidance-levels. Sorry, I tried to share screen, but it's not allowing me. And if I do get that permission, I have to reboot or re-enter the meeting. I've just sent you the link on your text.
Can you see my screen now?
Yes. Now, if you could go to, let's see, transmission index down below. Oh, right up there. Yeah, that's good.
Okay.
So the metric, there are 3 metrics that we use: 7-day average percent positivity, 14-day case rate per 100,000, and the statewide ICU utilization that I just talked about. The reason we use 7-day and 14-day is because we want to make sure it's a heavy enough measure that it doesn't create daily ins and outs of the different transmission levels. The rule is, in order to move from one level to another, you need to have 2 of the 3 that meet the qualifications for that level. So let's take 7-day average percent positivity, for example. A high level threshold is greater than or equal to 13% over a 7-day average for a county. A moderate level of transmission is between 6 and 12.9% positivity. And a low level is equal to or greater or less than 5.9%. So the 14-day case rate per 100,000 population is greater than or equal to 325, between 101 and 324 for moderate, and less than or equal to 100 for low. And then the statewide hospital utilization, there are 2 requirements or 2 conditions that need to be met in order for it to be met. So total utilization needs to be greater than or equal to 72%, and the COVID portion of the ICU is greater than or equal to 15%. In moderate, it's between 69 and 71.9, and between 6 and 14.9 on the COVID specific ICU utilization. And then on the low, it's less than or equal to 68.9% and less than or equal to 5.9% of ICU utilization. So if you can just imagine, when you look at this, you've got 2 of the 3 of these need to be met in a county for a trigger to be pulled.
So if I heard you right then, Rich, I live in Salt Lake County. We're going to show where counties are in just a moment as I scroll down. I would have met, in the high level of transmission, my county would have met 2 of those 3 criteria.
That's right. Salt Lake County is greater than or equal to 13% positivity. They also have greater than 325 cases per 100,000 on a 14-day perspective.
Now, we're going to get into, kind of our suggested protocols in each of these levels in a second, but I'm going to just assume for a second, I'm now the most strict protocol. When will I know that I get to move out?
Every Wednesday. Right now it's set for 2 o'clock. There is a committee that meets together to review the data. There's no requests that need to be submitted and no permission that needs to be granted. It is basically whatever the data says, and the committee meets together to determine whether or not the data is accurate. And this becomes increasingly important when you're dealing with counties that have a smaller population, because the numbers may not always be representing what's actually happening on the ground. So we bring in people from those areas to discuss what's happening on the ground and whether or not we can interpret that data correctly.
Okay, and so I'm in high. What's the minimum time I'll be in high in Salt Lake County if I live here?
So the review happens on Wednesday, for example, and the announcement is made on Thursday. The soonest you can go back to moderate from high is 2 weeks from that Thursday. And only then if the data, if 2 of the 3 metrics are are met in the moderate level.
I'm going to scroll up for a second. Are there any, so that our viewers can kind of see which counties are in which levels? Would you make any comments on any of these counties in particular about, you know, kind of how those decisions are made, or what some observations of what's going on?
Well, for example, in Rich County, they have a 40.6. So no, let me use a different one here. We have Paiute County that's measuring 1,107 positive cases per 100,000 people and 44.4% positivity. So that puts them way above the threshold in both of those categories. However, they only have 16 cases, so they're considered low. That gives an example of why that review would be important.
So that's an example of the judgment where the metrics kind of start to skew the real picture on the ground, and
Right.
in particular in I think low population counties.
That is correct.
All right, let's get into the actions then and what happens. And would you like me to scroll down, or is there something else you'd like me to refer to?
Well, if you could pull up, I haven't spent any time on this part of the website because I'm in the other documents where all the guts of it are. Yeah. So just making sure you have the right version there. I think you probably do. Is this the one that was online?
This is the one I pulled up off the website.
Would you mind making that a little bigger, please?
Oh, now you're well beyond my my capabilities.
Well, maybe we can call in some background. Maybe you're.
Good grief.
I think on the right side you just saw it. Yeah. Yeah, there's a little button there. That's good enough for me. I mean, I have a printout right in front of me anyway, but oh, there you go. Now you're getting really talented.
Yeah,
Very good.
I had to use the help bar. Sorry for those at home that have to put up with this.
So when we look at this, this model is really founded upon three main things: social gatherings, mask wearing, and public gatherings. So when we talk about social gatherings, we are literally referring to gatherings that don't have organizational oversight, such as family dinners, family reunions, friend get-togethers, little book clubs, any of those kinds of events where people are just getting together casually to enjoy one another's company or do things. In contrast to a social gathering is a public gathering. And if you wouldn't mind scrolling down to that category, it's down a couple pages. The public gatherings are just a little bit further, a little bit more, right there, are gatherings where any establishment or organization allowing people to gather together to participate in something, such as a live event, or outdoors or indoors, movie theaters, sporting events, weddings, recreational activities, different kinds of entertainment. You can just picture where there's a public setting where people gather together to participate in a common event. And so that's the difference between a social gathering and a public gathering. And over the past 7 months, this has been one of the hardest things to make clear to people. So businesses come and they say, well, it says only 10 when I'm in a high level, but yet my restaurant can seat 200. Well, the answer is a restaurant is different than a social gathering. A social gathering does not have organizational oversight like a restaurant does, or a sporting venue. So it's just important to understand the difference. So when we talk about the public order that was issued for the next 2 weeks for counties in high and moderate, that social gatherings are restricted to 10 or fewer, we're talking about those events that are casual, without organizational oversight. So that's a very important distinction, because part of the architecture of this is to protect businesses so that they can remain open and engage in business. And so that's one of the main distinctions. So if you could go back up there.
I will. We had actually a question come in on this topic, and I think you've addressed it, but let's revisit it for for emphasis. Tell me where you want to stop. Right here?
Yeah, that's great.
Okay.
Go ahead.
So this is going to sound repetitive, but I think this is a really key point for us here. So if your level is high and you can only have gatherings of 10 people, why would large organizational events or religious gatherings with organizational oversight be permitted?
Yeah. And the reason why is because there's some sort of an organization that takes the responsibility for the execution of a safe plan. Whereas a bunch of people getting together, there's no responsible organization that oversees that to make sure that it's done safely. Now, Taylor, before we switched to this, when we were in the color-coded phase guidelines, we did have a provision on social gatherings that if you were to follow the guidance in the events template in a social gathering, you could have more people there than what was listed. But we're not going there yet because we have got to get on top of the trajectory of this current outbreak. And so we've eliminated that as an option, and we're just sticking straight to the numbers that are listed there. The key is organizational oversight and accountability.
Thank you. All right, walk us then through the other parts of this that you think are really pertinent.
So the mask wearing is a little bit tricky. To me, that's the most confusing thing. The bottom line is there are three areas when we look at masks. I look at them through three lenses. One is in public indoor and outdoor settings that are not covered under the public gathering events. The second is the category of public gathering events. And the third is in other businesses, such as a law firm or a business that just conducts businesses amongst themselves internally, and they don't have a lot of exchange with the patrons from outside in person. So those are the three categories when I look through the issue of masks. And so let's address those. Masks worn in public indoor settings and outdoor settings, such as a store or a library, those have a flexibility based on what transmission level you're in. So when you're in high, when your county's in high, it is required that masks are worn in those settings whenever 6-foot distancing is not feasible. However, in moderate and low, masks are strongly recommended, but if they're going to be required, that's at the discretion of county executives and local health officers. So the exception to this is during the next 2 weeks, again, to jumpstart or break the circuit on the surge and get on top of this trajectory. In moderate, masks are required, there is a directive that is a very strong ask. We're directing people to wear masks in those same settings. In other words, to treat it, those moderate counties to treat mask wearing as if you're in high when it comes to public indoor and outdoor settings. So that's that layer. Now, if you'll go down to businesses, just a little bit down further right there. If you notice the second line there, businesses are required to maintain 6-foot distancing between household groups unless masks are worn. So that's the other area where masks are worn. And this is across all transmission levels. So we're in a business, you're at your workstation, no mask. Nobody around, no mask. When you're around others, such as a staff meeting, when you're sitting around a conference table, masks are worn, and physical distancing is still encouraged because we know that that works the very best out of everything. So we try to create physical distancing, but where we can't, then masks are worn. Taylor, you and I are in meetings multiple times a week, sitting around conference tables, and we're not quite exactly 6 feet apart, but everybody's wearing masks, true?
Yeah, that is the case.
Yeah, so that's kind of what masks are, the mask expectations in businesses. And then if you'll scroll down just a little bit more, you'll see the events right there. Any establishment that allows public gatherings such as live events, movies, that category that we just addressed earlier. Masks are required across the full spectrum at all transmission levels. Why? Because we are in a very serious state of transmission across the entire state right now. And we acknowledge that it's lower in some areas, but because it's so thick in so many populations, that there is such high risk of that being transferred in even to the lower populations as well. So that is, at this point, that's a requirement across all transmission levels. Masks are worn. Now, the exception in this case is performers. This is not quite the most current version. We got to get this updated, I just realized. It's performers that are performing. During the wording is performers are excluded during their performance. So a basketball player, a dancer, somebody in theater, you know, those types of performers are exempt from wearing a mask in these same environments. There is this option. Oh, go ahead, Taylor.
No, you keep going. I want you to finish your thought. We're getting some questions related to these events. So as you finish your thought, let's make sure we get these answered.
Well, just it's important to note there that there is a room for an exception in high and moderate, but that exception only pertains to physical distancing between household groups. There's not a provision to seek an exception for mask wearing. It's only for physical distancing. So, for example, in high, if there is a theater that cannot economically survive with 6-foot distancing between household groups because it just doesn't bring enough revenue, then with a safe plan that they put in place, which would include an events management template that they could use as a guide to create that plan, they submit that plan to the county executives, and they should, in consultation with local health officers, look at possibly making an exception to the 6-foot distancing at that venue. So in low, physical distancing between household groups is strongly encouraged, but side-by-side seating without physical distancing is allowed. So there's no exception needed in low. So that's a motivation for me and everyone else to get into low so that we can function like that. So anyway, back to the questions on this.
Well, some of these are real pertinent because we've got holidays coming out. I'm in high. Does that mean I can't have more than 10 people to Thanksgiving dinner?
You're in high, that's what that would mean.
Okay. So I need to be in moderate if I want 25.
That's right. Any more than that is just utter chaos and mayhem. So you could thank us later for reducing it. No, I'm teasing.
Yeah. Okay. Let's talk about weddings. We got a lot of people that want to get married. If I've got a personal residence where I'm going to have the wedding, and I have a caterer, and the caterer puts in regulations or oversight, does the caterer count as organizational oversight?
We would lean in the direction of yes on that, because what we're after is that accountability is taken for correct protocols and safety measures to be in place and enforced.
So let's talk about, I mean, you've reviewed a number of these plans. Give people a sense of the characteristics of these plans that would work, right? And maybe you know, I'm planning a wedding for my son or daughter in my yard. I've got a caterer. What kind of organizational oversight should I ask from the caterer? Well,
if you, I won't have you do this, but you could go online and look at the COVID-19 events management template. And the things that it addresses, it has a checklist about symptom checking, face coverings worn, making extra face coverings available, providing accommodations to high-risk employees and volunteers and patrons, and complying with distancing and hygiene guidelines. It allows you to, it promotes your thinking about how to keep attendance records so that if there was an outbreak, we could quickly notify people. It also takes you through some issues about social distancing at the venue and attendees at increased risk for severe illness. How do we treat them? And, you know, what are protocols? It gives you a chance to kind of think through that. Signage, posting signage so that people are aware of, if you have symptoms, please know we love you, but please don't come at this time. Or you know, about symptom checking and physical distancing to remind people, because you know the biggest issue is people aren't the disposition of people isn't always that they're trying to be rebellious. It's just that they're having a good time and they're engaging. And so signage is helpful. There's also issues of hygiene and sanitization, payment options, and some additional safeguards that they could consider. So that's kind of what that events template takes folks through.
Okay, thank you, Rich. We've gotten through a lot here today. I want to again encourage those listening to start asking questions. I think, Rich, you may have a couple more comments, and then we're going to open it up to wide open to questions. Anything else that you'd like to cover here?
Well, I think there's a couple of key points to recognize, and that is that there are some basic fundamentals that we are simply always promoting. And outside of social gatherings, being cautious. And by the way, I would say, if we could get all of you on this call in your circles of influence to just simply somehow make a small difference with social gatherings over the next couple of months or even weeks, we could make a big difference. It requires literal change, however. Our trajectory will not change if we don't change behavior. So that means literally modifying what we do. And I personally am making personal modifications to my personal schedule because I'm serious about this. And it's not just a nice theory for everybody else to do except me. If we each were to do that, it would go make a big difference and go a long way. But some of the other basics that I think that we need to just know that are fundamental to this, and we've talked about them, it's social gatherings, it's mask wearing, it's physical distancing, it's hygiene, and it's staying home when we're sick, and it's following public health quarantine and isolation protocol. Those are some of the main things. And one other thing that I think is important to understand is when it comes to schools, people have this question a lot. Where do the schools fall in this? And the answer is, if you'll go down below to the bottom, the second to last row right there, schools follow the school manual and the Utah State Board of Education's reopening handbook. That's where they go for their guidance, because there's very specific planning that goes on in there. And the decision as to whether or not a classroom or an entire school goes to virtual or remains in-person learning is up to the local elected officials. It's up to the local school officials in correspondence with the public health officers. And they are running differently in the school settings. And I will say too that the K-12 mask mandate, the public health order, still is in effect in all K-12 schools, private and public.
Thanks, Rich. I'm going to stop screen share, if that's okay with you.
That's great.
And we'll just start taking some questions. And I'll just start with a few here. I'm going to try to order them in some logical orders here. Recommendations for gyms and fitness centers where physical exertion is taking place. What are the recommendations there?
So again, it's physical distancing, it's hygiene and sanitization, it's being smart about how many people are in the gym at one time. It's about monitoring where if outbreaks or transmission is happening at the location, and to take action quickly. But you know as well as I do, a little bit of prevention goes a long way in saving the reputation of the business and also the revenue flow of people, the patrons that visit it.
Question on enforcement. How's the state going to enforce these levels? Are there ramifications for those that don't abide?
With everything except the directive, these are all legally enforceable. That is not our goal. We are appealing to the better side of people just to do the right thing, to do what we're asking, even though a lot of people disagree with it. At some point, the collaborating and the badgering and the discussions have to stop, and we have to say a decision has been made. Let's fall in line with the leadership, the governor, and do what we think is right. Like I said in the press conference, we have a lot of people that are so anti-masking that it's almost their religion anymore. And we say to them, we can respect that. We're still asking you to wear a mask. If you can't wear a mask because it's against your religion, which is hard for me to comprehend because a mask is so simple and non-invasive to be able to conduct basic normal life. If you can't do that, what can you do? Can you support us on the social gatherings? Can you support us on the physical distancing or the hygiene practices? Can you put out public messages? Can you do things that actually influence for the good cause and the common good of us all? That's what we say. We don't plan to enforce it with law. We can, and hopefully we won't ever have to do that.
Thanks, Rich. Question about bars. What's the guidance on bars? We kind of skipped over that.
Well, bars are in high, there are specifics in each level. In high, 6-foot distancing between parties at all times, including in the waiting areas. And I know that's totally contrary to the purpose of a bar, but bars are nationally known as a problem. We have to take action with these. So again, our whole focus is to keep a business open the best we can. And in this case, we're saying in a bar, 6-foot distancing is required in high. In moderate, we're looking at the language that says that 6-foot distancing between parties is strongly recommended. However, because it's strongly recommended and there's leniency there is a requirement for 75% capacity as the maximum that is filled. And patrons should wear a mask when intermingling with other parties. And you should have seen my wife and daughter making jokes about this. They were role-playing being in a bar with masks on, with the kind of conversation that would happen there. It was actually hilarious. But so it's a little contrary to that setting, we get it. But nonetheless, we're asking for this behavior to take place and for the support of those that own and run the bars. And in low, 6-foot distancing between parties is strongly encouraged. So
Okay.
Let's get to low.
Rich, we've been at this a long time. We've got a couple questions that refer to the fact that why do we think this will work now? We've been asking people to do this for months.
Well, here's the thinking. Generally, people have kind of, there's a polarization that could be possibly identified. Those that are simply against, they're just never going to cooperate. Okay, we hope that somehow they'll come around and do something. There's those that will just cooperate no matter what, and then there's a lot of people in between. What we're hoping by this, and again, this has been a delicate dance because you get opinions from both sides, not doing enough versus doing too much. The hope is that by placing much more of the responsibility into businesses and calling upon the general public in a way that, and when we say calling upon them, we're distributing the information about the transmission level in their area. The thinking is that if they're aware of the transmission level, just as a natural response as a human being, it would be that I'm aware of the transmission level, and if it's high, I need to be a little more cautious. The key is getting information into them all the way down to the end of the row so that people actually know. Those are some of the things we're working out right now and that we could use your help on statewide to be able to get this information to the end of the row. What we're doing is we're taking the approach that there's less government regulation and more calling upon people just to do the right thing. And we're thinking that'll work, especially that now that we've got 7 months of training and learning, as you said earlier, about how to interact with this virus. We're at a pretty high spot, as we all know. This is very high. We're among the top in the world. Top 5, maybe top 6 in the world. We are appealing to people to on a personal level, to simply adjust their behavior and support this. And we're hoping that this approach and getting the information to them, pure data, get the politics out, just what does the data say? We're hoping that people will look at the data and make decisions based on the data, and that all the businesses we'll run a very tight ship, because if the businesses go south from here, then we have to go backwards in this. But we've seen such great response from businesses. They've been so careful. So many of them have. We've had outbreaks, we've had problems, but generally businesses have been phenomenal. So we hope that the businesses will continue to be vigilant in practicing these principles, so that that whole layer of this response is protected and a great asset to our whole approach. So that's all I would say is we're pleading. We need help. We cannot do this without everyone's engagement. We can't.
Thanks, Rich. Question. This one's interesting. I think looking for some suggestions. Someone calling in from a low population county and hearing that in their county there's a little bit of a rumor on the street that you shouldn't get tested unless you're really sick. That obviously now skews your percent positivity higher. How can you encourage people to just go get tested?
Yeah, that's a tricky one. We hope that everyone's afraid if I get tested and I'm positive, then I'm all of a sudden stuck. And in reality, there is some adjustment that needs to be made if you're positive. And if you want to decrease the percent positivity, increase the tests. And so from the leadership of communities, increasing testing is critical. It does two things. It has a likely chance to decrease the percent positivity. The other thing it does is it gives us a truer read on what the prevalence of the virus is. Both of them are wins. And so we hope that people will engage in testing. Another thing that we're doing is we're working on a change to the statewide testing strategy that eventually in the weeks to come, anyone can be tested anytime they'd like. And with the rapid test that give that turnaround time in 15 minutes or so, that's just a huge value to our approach. So you'll be able to go to different locations like a Walgreens or a CVS or something, or Walmart, and have a rapid test performed and then know your results within just minutes. That's in addition to the current testing strategy that we already have been using, the nasal swab, the NP swab. And then also with the saliva testing, people can take the samples at home and then send them into the labs for results as well. So we're trying to make it so that anybody can be tested anytime they want. And now we're trying to inspire people to actually engage in that so that we can know prevalence and they can help drive the percent positivity down so that we can move to low.
So a question around the flexibility of social distancing and masks in businesses. Sounds like there's some flexibility here for business. Can you talk a little bit more about what types of organizations and businesses, have that flexibility?
Yeah, I think what we did is we tried to identify businesses or organizations that, or establishments that would draw the masses together to participate in an event. We put those in one category. And then we tried to identify all the other businesses that people go to that don't have a lot of interchange with lots of people from the outside. And those are the, so businesses in general, whether it be a retail store, so a little bit contrary to what I just said, but retail outlets and other businesses like law firms or libraries or those types of organizations, they all have flexibility. And the flexibility is that they're not required to wear masks in moderate and low, but 6 foot distancing is the primary tool that we're using in these businesses to help promote the good outcome. So these businesses just have the ability to run accordingly in moderate and low, except for the next 2 weeks. Of course, the moderate is to be treating it as if it is in high.
Got a direct question from some of our Chamber of Commerce leaders. What's their ability to offer conferences and events? What guidance would you offer to them?
You mean, can they have a conference?
Yeah.
Yeah. Or can they have a, like the hunting expo that's coming up? Yes. The events template is required. In fact, if I go to the document.
We had a question on where is that? Could you point that out where that is?
You were just online. Did you pull it up from online?
You know, I didn't. We may get into unknown territory if I try to do that again.
Let me just go, the transmission index on that coronavirus.utah.gov.
I will be posting it.
There is a document called the transmission index by county, and then there's the health guidance. It's the health guidance document that has this. So if you go to coronavirus.utah.gov.
Rich, we'll post it. I think my assistant's got that working now. She'll post it for those that want it.
Good, because that was the most stressful thing you've asked me since we started this.
Yeah, sorry about that. Quick note from Brian Shiozawa at University Health, and would love to talk to any of you leaders about mask requirements and how you can make them reasonable and appealing. Let's see. Question about false negatives for rapid tests. Tell us about the accuracy of these rapid tests, the ones that are going to be coming in.
Well, the rapid tests, and Brian can talk more to this if he'd like, but the rapid tests, primarily the Abbott, the Binax tests, are primarily geared for people that are demonstrating symptoms. However, if they're used frequently, they're good for surveillance in terms of asymptomatic testing, but they have to be used repeatedly in order to be a tool to pick up the virus when it hits a certain load. And so we encourage those tests to be used primarily when there are symptoms, or if there's access to them on a more frequent reoccurring level.
Yeah, I'm just going to step in. We've got a great question from someone who's confused about the moderate level, in particular through October 29th. So what we are saying is we're taking as circuit breaker those counties in moderate through October 29th need to think as masks as a directive and a requirement. That's part of the circuit breaker. After the 29th, then it is, as the guidance states, it's highly recommended.
That's right. Unless a specific jurisdiction, a local county jurisdiction, imposes a mandate on their own right.
Yeah. Quick question about PPE in rural areas. We still do have PPE grants. You can go to the coronavirus.utah.gov, and in the business section, you will find a place where you can actually apply for those grants. There is still some money in that bucket. We would encourage you to do that quickly. In particular, we know that there are some rural counties that have been elevated in this new system, Garfield in particular, and would love to, if there's anybody here from Garfield, would be happy to set up a webinar with our PPE grant specialists and walk all of you through that. All right, we're getting to the end, and I've been holding off on two questions, and I'm going to ask them now. One has to do with vaccines, how they're going to get distributed, when we can expect them. And the other companion question to this is, when is this going to end, Rich?
Well, whoever asked that question would please slide me the answer. I would be glad to announce it. So as far as the vaccine goes, we have a vaccine council that has been meeting regularly for many weeks now. We know that when the vaccine comes out, it will not be available to everyone right off the bat. So this council has been meeting. CDC has some very strict guidance that we just simply have to adhere to. They state what priorities are what for this first tranche or the first several tranches. And so those priorities focus, of course, around healthcare workers, first responders, and those maybe the long-term care facilities and those types of individuals. It was originally stated that we would have our first tranche of vaccine around the 3rd of November. We have heard that that is now delayed. We don't know the specifics, but we anticipate starting this vaccine process either November, December, or January. And we guess that within several months after that, we will get more and more, and eventually within several months, we'll be able to have enough for whoever would like to be vaccinated. The key is, does it work, and is it safe? And that's what we're waiting for, all of the studies and the reviews to come out through the FDA, which they have independent bodies that are involved in that process. And so we're waiting for that. So when will it all end? You know, I don't know. I hope in my mind, and I'm not the expert, but in my mind, I anticipate the day when it's treated similar to the flu, influenza, where we have, you know, a good portion of the population is vaccinated and herd immunity is reasonable and people can go about life normally. I would bet that in the future, we'll have a whole lot more open mind about using masks, even just for flu season. I think that'll be kind of something that will be really important to move on. But I think that that our goal right now is to figure out how to manage this situation together. That means you and me together until we get to the point that I've just described. And we've got to do things together, like sacrifice some things. We've got to wear masks, even though we hate them, like I do. We've got to watch our social gatherings and our physical distancing. We just need to cooperate together and live life a little differently for a while more. And we can do that. We can almost do everything we want to do right now.
I've got one more particular question about an event. And I think this is particularly poignant because all of us want to celebrate Halloween here soon, Rich. So this is an attendee that's in a moderate county. Want to know if they can do a large organized event without attendee contact tracing. The event, I'm going to read this, is outside. Mask will be worn and 6-foot distancing between families will occur. This would be a Halloween event. Gathering names of every attendee would cause a bit of a bottleneck at the event because it would be difficult to do 6-foot distancing. So the question is, good event, social distancing, masks, outside. Do we have to have contact tracing?
So I'll respond with a diplomatic response. I would hope that they would put together the principles that are in the events template. I would hope that it has some organizational oversight that's responsible for the enforcement of these things, the promotion of the principles, the execution of the principles. And I would hope that they would be able to keep the physical distancing, the mask wearing, and all those things that would happen and have a very safe event. And I would hope that if there was an outbreak that occurred there, that because of the practicing of these principles, the spread would have been minimal. And that if we need to contact people that were there, we could do it in a way other than a global radio announcement of some sort, just to keep things a little bit quieter to, you know, we don't want to hurt people's reputations or anything. So we would hope that those things would take place. Okay.
Rich, I don't mean to push you on this, but your attitude here seems to be we're trying to get people to do events safely rather than not do them.
Correct.
So the way I've looked at this, and correct me if I'm wrong, is we're going to have this for a while longer. We got to learn how to operate safely. So we got to try some things. And in the spirit of trying, we ought to try it, see what works.
Yeah. And we know that there are principles that are tried and proven.
Right.
This is the physical distancing, the masks, the social gatherings, the hygiene, sanitization, stay home if you're sick, symptom check when you're dealing with people. All these things they just matter. They work.
All right, one last question, and then we'll close it off. 2 or 3 people sharing an office in a moderate county. What should their office space look like?
Well, here are the triggers. Close in proximity, inside, for long periods of time. So if you implement measures that kind of reduce those threats, the better you mitigate, the better you'll be.
Perfect. I'm going to sum it up here with a attendee that just said, let me make sure I've got the key principles right. The primary preventative action is social distancing. Masks are secondary and required when social distancing is not feasible.
That is a good summary.
All right. Thank you, attendee. There you go. You've got the Cliff Notes version of what we've tried to do today. I'm going to turn it back over to Derek in just a second, but let me just end with this. And Rich mentioned this several times before, and I don't want to get with too much hyperbole here, but Abraham Lincoln, in 2 addresses to this nation, trying to get it to come together and behave in a way that would hold our country together, often said, I'm appealing to the better angels of your nature. And I think that is fundamentally what we are trying to do here. This new guideline is putting, hopefully, principles in your hands, and we are appealing to the better angels of your nature to try to protect people and keep operating economically and safe. And with that, Derek, we're going to turn it back over to you.
Thank you. Thanks so much to both of our panelists today for spending this time with us, and especially spending so much time addressing people's questions. As much as we try to come up with guidelines, guidance, rules, and restrictions, it's in the application of that that we often find the most challenges. And so having an opportunity for those who are on in the audience with us today virtually was a really important element, and appreciate you spending so much time on it. We want to thank Rich Saunders. He's the acting director at the executive director at the Utah Department of Health, and Taylor Randall, who's the dean at the David Eccles School of Business at the University of Utah. I had the opportunity this past weekend to spend a significant and unexpected amount of time with these, as well as other dedicated public servants. And the only reason I mentioned that, when I was invited to a meeting Friday evening, and then again Saturday evening, and then again Sunday evening, as this index was put together, it became evident to me that although that was a very minor inconvenience for my weekend, that these were individuals who put this information together, who've been spending their weekends this way for a long, long time. And we appreciate it. We're grateful for it. Thanks to please pass along our thanks, Rich, to your team at the Utah Department of Health, who are all trying to keep us safe and healthy. Thanks again to all of you who have participated, especially those members of the business community who are really doing an excellent job, and in so many ways showing and setting the example of how we can all stay safe and keep people safe, keep people healthy, and at the same time, keep our economy going. This will conclude our webinar this afternoon. Thanks again.